Physiology of Lactation, W7 Science Theater at gmail.com. Contact us for more information and consultations. I would like to, that is our banner, W7 Science Theater. Don't forget to like. All things are good. Share. Yes, and subscribe for more and better videos. Alright. Subscribe for more and better videos. Okay. First, physiology of lactation. Let me first show you how the breast looks like, because I'm gonna be using these terminologies and I want you to be informed about that. If I have intercostal muscles here, and these are the ribs, I have pectoralis major muscle. This is minor. So pectoralis major. Let me just look at the breast as it is here. The breast has suspensory ligaments. These ones are suspending the lobules, okay? And we have fat. Fat makes much of the breast. That's why it protrudes out in women. Fat deposition. Then this is just skin, lactiferous sinus. Yes, lactiferous lobules. This is the nipple, where the tubules, lactiferous tubules, do open at the nipple. Okay, there are several at the nipple. That's the breast. And the phases of lactation are divided into 4 phases. 1, mammogenesis. This is preparation of breast for milk secretion. We have 2, lactogenesis, synthesis and secretion of milk. Then we have galactokinesis, the expulsion of milk. This is at the cellular level. Cells are synthesizing milk and secreting the milk. Okay? Then galactokinesis, expulsion of milk, and lastly, galactopoiesis, which maintains lactation. Yeah, poiesis, galactopoiesis, synthesis of maintenance. Okay? Let's see. Lactogenesis has stage 1, and this is in the later weeks of pregnancy, where a small amount of fluid is secreted in the alveolar cells due to high plasma levels of prolactin and placental Schumann chorionic somatomammotrophine, but due to suppressive lactogenic action of estrogen and progesterone, free flow of milk never occurs during pregnancy. So, lactogenesis is the first stage. And this stage, you're only secreting a small amount of fluid in alveolar cells. And this is due to these 2 hormones, HCS and prolactin. But estrogen and progesterone are in high levels, so they suppress lactogenesis. Okay? And free flow of milk never occurs during pregnancy. 2. Stage 2, we have, involves the initiation of lactation after childbirth due to sudden loss of progesterone secretion by the placenta, and this allows lactogenic effect of prolactin. Prolactin is positively lactogenic. It supports the synthesis and secretion of milk, okay? Whereas the gonadotropins are inhibitors, okay? And secretion rate increases from 500 increases to about 500, 750 milliliters per day. All right. Look at this, curves. Have progesterone, gestation, and after birth. Okay. So if you look at these graphs, you can see estrogen is high during gestation and decreases at birth to low levels. Prolactin increases during gestation, and after birth, pulses are seen in its secretion. Prolactin, all right. Then you have progesterone, which is also high in gestation but decreases during after birth. Okay, so these two hormones inhibit. All right, so that is it. Postpartum, you've seen. Types of human milk. One, we have colostrum, which is secreted during the first few days of postpartum period, and it contains high protein content. You can see 8.5 grams per deciliter. Wow. Rich in immunoglobulins and lactoferrin and granular bodies. These are colostrum corpuscles. It consists of alveolar cells and leukocytes loaded with fats. Yeah, cells will be budding off and entering into the milk. It will be secreted entire cell, okay? We have transition milk or intermediate milk. It is secreted from 6th to 15th day of postpartum period, about end of first week and second. There's colostrum changing to mature milk. That is transitional milk. Then mature milk is formed from 15th day of postpartum period. These days are important if you get them. Yeah, they can be objective type questions. 15th day. Postpartum onwards and continues during the whole lactation period, 7 to 9 months. Okay? Human milk contains 88.5% water if it is mature, and solids contribute 11.5%. Let's talk about the suckling reflex. When a baby suckles, skin receptors on the nipple and areola are stimulated. Afferent nerve fibers carry impulses to the spinal cord. This is a somatic nerve, the spinal cord. They are sent to hypothalamus, and the hypothalamus in turn causes anterior pituitary gland to produce prolactin and posterior pituitary gland to produce oxytocin. All right, we know this is made it is synthesized in the hypothalamus and flows via axons, neural secretions to the neurohypophysis, so it is secreted. And prolactin, that is anterior pituitary or adenohypophysis. So these two hormones, when they are released, they go to the breast. They will stimulate areolar cells to secrete milk, galactopoiesis. All my epithelial cells are stimulated by oxytocin to expel the milk out of the breast, galactokinesis. Okay, synthesis, prolactin. Expulsion, oxytocin. That is the suckling reflex. This is the reflex response. This is the reflex initiator. Okay. Advantages of breastfeeding to the baby. Yes, breastfeeding is very important. You should inform the mothers and the children and everyone, ladies, that breastfeeding is very important. Though we have a lot of job to do, it's very important you breastfeed your baby. First, to the baby, it is balanced diet, because it contains proteins, carbohydrates, fat, mineral salts, and vitamins. Let's say calcium and phosphorus. Okay? It is protection against infections in a baby. Human milk contains high number of lymphocytes, neutrophils, and macrophages, and high content of lysozymes and immunoglobulins or antibodies. These are important in body defense to the baby. Okay. Growth hormone promoting factors are also present in breast milk, like epidermal growth factor, insulin, and IGF-1. These are present in the human milk. So when you give them to the baby, they are very important. Casein is easily digestible. I want to talk about the contents of milk. And look at this. Casein is easily digestible. Lactoferrin prevents iron overloading. The folate and cobalamin, these are vitamins. Vitamin binding proteins assist in absorption of corresponding vitamins. Yes, and has higher concentration of lactose, which promotes calcium absorption. The lipases assist in lipid digestion because lipid digestion is poor in newborn babies. So all these are contents of milk. We've said casein, lactoferrin, vitamin binding proteins, lactose, and lipases. All these are important to the baby. So it's better you breastfeed. Other advantages of breastfeeding to the baby. First, milk is sterile. Milk is convenient to give at the right temperature. It is inexpensive, very cheap. You just pull out your breast and you feed the baby. And chances of allergy to breast milk are very rare. Yes. Advantages of breastfeeding to the mother. It is very important for the mother to breastfeed. First and foremost, lactation amenorrhea. The FSH and LH are suppressed by high levels of prolactin, so lactation amenorrhea occurs. 2. The involution of uterus is normal occurs when there is breastfeeding, because the oxytocin released in breastfeeding acts also on the myometrium. This protects uterus against infection. If your uterus is involuted, it goes back to its position that is protected against infections. Alright. Protection against breast engorgement. If milk is stagnant, it acts as a favorable medium for bacterial growth, and you can get engorgement of the breast. Okay? Body fat is used for milk synthesis. Therefore, there are less chances of becoming obese if you're breastfeeding. Let's continue. Breastfeeding promotes an emotional bond and psychological satisfaction between the mother and the baby. Okay? Prolonged lactation provides protection against breast cancer. See, this is related to bacteria here. Yeah, prolonged lactation protects individual against breast cancer. Yeah. So don't you forget to subscribe for more and better videos. You like, you share,